Hi, I'm Rachel Ashby, and I'm an infertility specialist at Brigham and Women's Hospital in Boston, Massachusetts.
Hi, I'm Sarah Little. I'm a maternal-fetal medicine doctor, or a doctor who takes care of women with high-risk pregnancies, also at Brigham and Women's Hospital, and the co-director of our diabetes and pregnancy program. So we are here today to talk about obesity and its impact on getting pregnant and pregnancy itself.
So Sarah, a question I get a lot is, at what level BMI do we start becoming concerned about effects of weight on fertility and in pregnancy? And where do we kind of start thinking about that? And typically we think about a BMI of 30. So if your BMI is over 30, you're in a category for which there might be issues associated with both fertility and pregnancy. And for many patients that come and see me, their question is, if my BMI is elevated, is that why I'm not getting pregnant? And the answer is usually not. So BMI can impact pregnancy and how you time it to pregnancy, but it rarely is a independent variable for getting pregnant. When we think about how BMI impacts pregnancy just in the general population and getting pregnant, we know that women with elevated BMIs tend to have a longer time to pregnancy, as well as a lower probability of pregnancy on a monthly basis. So losing weight is always something that we think about may improve someone's speed to pregnancy. BMIs that are elevated also have a well-known impact on infertility treatment. And when we think about it really in two broad categories. So some women have infertility associated with a condition called polycystic ovarian syndrome. We know through many years of research that BMI elevations and polycystic ovarian syndrome can negatively impact a woman's chance to get pregnant. But one question that's been considered, I think, a little bit more in the literature in the last 5 to 10 years is, what about women who don't have PCOS, who have very normal cycles? Does BMI impact their chances of getting pregnant? And that is where the studies that I alluded to earlier show that it takes longer for you to get pregnant, as well as the probability just on a month-to-month basis of getting pregnant is a bit lower. So these studies are fairly conclusive, but not an independent variable for infertility.
Yeah. So obesity wouldn't change your recommendation for when to seek infertility care?
No, it really wouldn't. Okay. And in fact, I think that's an important message for women to hear, is that if your BMI is elevated, you do not need to lose weight to an ideal BMI to seek infertility care. We usually recommend for women under the age of 35 to be seen by an infertility specialist after a year of attempts. Right. If you're over 35, it's really 6 months, and if you're over 40, you should be evaluated immediately. And an important thing to understand is some women with elevated BMIs stop ovulating. And one of the ways you'd know that you're not ovulating is you're not having normal periods. If you're not having normal periods, you would want to seek care immediately from an infertility specialist, because all of that time you're unable to conceive if you're not having normal periods. So that's something that you don't have to wait that interval in order to be seen. So infertility treatment has come a long way over the years, and it is very successful. And so I encourage patients that are considering seeking a consult with an infertility doctor that your doctor will do a series of tests to try to understand what is causing your fertility problems. And we'll go over with you a series of options of which you get a lot of information about success rates, risks, and benefits. And I think it's very much a collaborative approach where patients and their partners and the doctor can kind of come to a good understanding of what the best type of treatment is. And really the success rates are excellent.
Great.
So Sarah, one question my patients ask me a lot is, am I a high-risk pregnancy and based on my weight? And if that's the case, how do you counsel those patients?
Yeah. So sort of yes and no. I think obesity is a sort of an independent risk factor for some pregnancy complications. So women with an elevated BMI, especially women with a very elevated BMI. So it's a continuum, right? So if your BMI is over 40 or over 50, then those risks are going to increase even more. So I do consider those pregnancies to be high risk, or women with an elevated BMI who have other underlying comorbidities or diseases, right? So if you also have diabetes or hypertension, then certainly it would be considered high risk. There are some pregnancy complications that are increased for women who have an increased BMI. So first trimester, slightly higher risk of miscarriage, which you see in your practice as well. And then the main medical complications that we see in pregnancy for women who have an elevated BMI are gestational diabetes and pregnancy-induced hypertension, which can come in a variety of flavors, whether that's gestational hypertension or preeclampsia, but both of those complications are more common. They're the two most common medical complications of any pregnancy, but their risk is 2, 3, 4 times higher in women as their BMI categories get higher and higher.
A lot of my patients are scared to get pregnant because they think these complications are so risky that they shouldn't get pregnant.
Yeah.
But I know you often say it's not as high as people think.
Yeah, it isn't as high. Even in the highest, I tell women, at the end of the day, the most likely outcome is they're going to have a healthy pregnancy and a healthy baby, right? At any BMI, if they're watched closely, are coming to their appointments and doing well, that is by far the most common outcome. And then, the medical complications we see, even though they're more common, they're not always associated with poor outcomes too, right? And they're very manageable. Right. Gestational diabetes, we have great treatments for. We follow them, and whether it's most women are able to control it with diet alone, right? A small minority actually end up needing medications, but even if they do, they're safe in pregnancy, and we can still achieve a healthy pregnancy outcome with them. Same with hypertension in pregnancy. It comes in a variety of flavors, right? But the vast majority of hypertension in pregnancy is a mild disease near term, right? That still has very good outcomes. So, important to be screened well and to be monitored in the pregnancy. But not usually a reason alone to not become pregnant. Yeah.
When do you recommend, Sarah, a patient see a high-risk specialist prior to getting pregnant, just for counseling to understand what the risks look like and what your recommendations? Do you have a BMI cutoff, or what do you suggest?
In general, we are happy to see anyone who, feels like that would be a benefit to them. Yeah. But in general, I particularly like to see women who have BMI over 50 or over 60. That is a high enough risk factor alone that it's worth having a discussion prior to them becoming pregnant about what we're going to do in the pregnancy, how we're going to manage it, and to make sure that they're being taken care of in an appropriate place.
Sure.
And then for lower BMI, so 40 and over, if they have other comorbidities, it is good to get in and see a preconception. There's not only just talking about the pregnancy, but appropriate screening. There are things you can take care of. Make sure they're optimized prior to a pregnancy, whether that's screening for diabetes or hypertension, or optimizing their nutritional status.
And the types of medications they're on.
Exactly, a lot of people have questions about the medications they're on, or whether they should change any of that prior to pregnancy.
One question I get a lot of, and you probably do as well, is should I delay pregnancy to lose weight? And would that be a benefit? And I tell people it's really a mixed bag, in the sense that age is the thing that trumps all factors when it comes to getting pregnant. So for women over 35, we really worry about a big delay. And so we don't advise women to delay seeking treatment or delay getting pregnant just based on BMI. So when I'm counseling patients, we really talk about a concurrent method to say, while I'm trying to get pregnant, while I'm worked up for infertility, can I start looking at my eating patterns and exercise to find a really achievable, realistic way to slowly lose weight while I am trying to get pregnant?
I similarly, I have the same advice when I see them. It's really the youngest women who have potentially the time to wait. If you have a gastric bypass procedure or a bariatric surgery, you really need to wait about a year. So you're out of that period of rapid weight loss to think about getting pregnant. So it's a time older women don't have to wait. And then some younger women actually are just ready to start their families too. Sure. And even if medically they could, they're not in a place where they can.
And some studies conflict. There are studies, especially looking at women with PCOS, that do improve outcomes over time with weight loss before pregnancy, but there's another well-done study that showed really at 2 years no difference with some interventions. So I think the idea is to try to make a lifestyle change that's meaningful, obtainable, and uplifting for patients who are trying to get pregnant and for patients who are pregnant. And I think at the end of the day, it helps them maintain a healthy weight throughout their lifetime, because I think, I try to emphasize, and I suspect you do as well, that we're not trying to lose weight to get to a goal. We're trying to maintain a healthy lifestyle that's going to help people live a long and healthy life to raise their children.
Yeah, no, absolutely. And just small changes in weight can make a big impact on pregnancy outcomes, or not even the goal of losing weight, just being exactly like you were saying, just being healthier. So exercising more, eating a healthier diet, even if that doesn't result in any weight loss. You want to come into your pregnancy feeling like a good version of yourself, right?
Yeah,
so, I encourage people, it's can be several months of trying, or through infertility treatments before they get pregnant. So they still have a little time, even if they're working on both at the same time. So,
Absolutely.
Yeah.
Do you recommend, Sarah, women with an elevated BMI to be seen in kind of a tertiary care hospital or a hospital that you feel has the resources to care for these types of patients?
I think for women with BMIs over 50 particularly, that you do want to be at an institution that has the resources to take care of that. I mean, it does involve specialists and people with specialized knowledge and the sort of ability to take care of and the comfort level in taking care of, whether that's anesthesia colleagues who are comfortable with airways or placing epidurals on women who have an elevated BMI, ultrasound equipment and sonographers who are, used to scanning women who have an increased BMI, so you can really see and screen them well. And really the right equipment at the time of delivery, right? So you want to safely get someone through their labor, and there are, specialized equipment, whether that's beds or instruments or retractors that can make things safer for women with increased BMI. Yeah.
It makes me think about one very important point that I think everybody should understand as well, is when you're seeking infertility treatment, some practices have some very strict limitations on BMI in patients they would treat, and it's not always apparent to patients. So if you're seeking infertility care with a specialist, an important thing to understand and ask your doctor is, do you treat patients at my BMI?
Yeah.
And if I were to need something, for example, like in vitro fertilization, would I need to lose weight to be a candidate for that in this practice? Because there are practices that have very kind of strict cutoffs based on some of the outpatient settings in which they do their procedures, whereas, for example, here at Brigham, we are doing our procedures in a hospital setting, so patients can be cared for safely, really, with BMIs at all levels. So I think that's an important thing for you to consider when you're seeking your infertility care as well.
Yeah, and that makes sense. You don't want to have to switch in the middle.
Yes,
too.
yes.
So being upfront and asking those questions at the beginning, that makes a lot of sense. All right, so what questions do you usually get from women with an increased BMI who are seeking your care?
Yeah, so one question would be, for patients who are coming to see me very early in the process, do they need to go straight to infertility treatment, or can they try to conceive naturally? And the answer is that although BMI can sometimes increase the time it takes to get pregnant, but if you're just starting your journey to get pregnant, conceiving naturally is always the best. And so giving yourself a period of time, if you're having normal cycles, to try to conceive without any level of treatment is always ideal. But as a reminder, if you're having difficulty conceiving and you're seeing a specialist, there are many causes of infertility, things like a male factor infertility with a partner who has a low sperm count, or sometimes people's tubes can be blocked. And in that instance, you could be doing everything right, but you're not going to get pregnant without something like in vitro fertilization. So I think it just depends on how you're doing. And if you have any questions, seeing a doctor for a consult is really an educational experience. It doesn't mean that you need treatment or that you're signing on to anything, but really just getting yourself educated about getting pregnant. And I suspect similarly about being pregnant at an elevated BMI, which has some special risks associated with it.
Absolutely.
So what other questions do you sometimes get from women who are going into pregnancy with an elevated BMI? Like, for example, do they ask you, how's my delivery going to be? And is that more complicated?
Yeah. They do sometimes ask about the process of whether they're going to need a C-section just because they have an increased BMI. Which is really no, right? So we don't do C-sections just because of the increased BMI. But labor and delivery can be a little bit more challenging, right? So the process of being in labor, for whatever reason, with women with an increased BMI can take a little bit longer, right? Especially the first part of labor, from going at the very beginning to where you're fully dilated and pushing, can take longer in women with an increased BMI. So being patient for both providers and patients themselves with the process of labor is important to remember.
I'm sure.
Yeah.
One question I get a lot is, what are the resources available to my patients trying to get pregnant who really do want to safely pursue weight loss? And there are two big resources that we do. We have a wonderful hospital-based nutrition group that we refer our patients to, who really focus on a lot of aspects of helping patients understand, what should I be eating? What are some of the goals? They also talk a lot about exercise and how that facilitates weight loss. We also have reproductive therapists who see our patients, because it's really upsetting to be infertile. And I think it's upsetting for women who have an elevated BMI when they're getting a lot of messages to lose weight, and it makes them feel this sense of, well, maybe it's my weight, and it usually isn't. So I oftentimes offer those options as well, just to talk to somebody, because they're going through a lot of changes trying to get pregnant.
Yeah, no, absolutely. And when they are pregnant, to continue to follow, there can be challenges in being pregnant at an increased BMI, and following with, social work, therapist, whatever, in addition to the medical care, is very important.
Yeah,
yep, absolutely.
Right. Well, I know that we have some questions that will be coming in soon from our Facebook audience. So, okay, here's our first one. Katie says, what resources are available to support new moms, including high-risk moms and moms with obesity, during their pregnancy and their postpartum?
Yeah, so as you were talking before, we have a lot of resources here at the Brigham with nutrition and social work and therapy for women, as well as their team of doctors taking care of them, and specialized clinics with people with lots of expertise. In the hospital too, we had anesthesia doctors and neonatal doctors who have lots of expertise in caring for women both before and after they give birth, lactation support.
Yeah.
So there's some resources available online that are great, actually. The American College of Obstetrics and Gynecologists, or ACOG, has a lot about nutrition and pregnancy. That's great. Yeah.
And these are resources for patients as well. They can kind of easy to understand, not too medically oriented. That's good.
Yeah, we have a nice packet here for our new patients about nutrition guidelines and how to optimize the health of their pregnancy at any BMI. So,
that's great.
Yeah.
Do you have any books you ever recommend for your patients as far as just kind of basic pregnancy stuff? Do you probably get that a lot?
I do. Yes and no. I think some of them. Yeah, exactly.
Bunch of good general books.
I like the good old What to Expect When You're Expecting. Honestly,
I think I had that one too.
Yeah. So tell them not to spend too much time Googling things, because you can get some bad resources.
It's really true. I think it's a bit of a mixed bag. There's some good information and some not so good.
Yeah,
so
exactly.
Oh, here's another one.
Great. So Meredith is asking about exercise in pregnancy and whether that's safe. Absolutely. I mean, that's an easy one, actually. So it's definitely safe to exercise in pregnancy, and we encourage it, right? So especially recently, actually, there's been a lot of data showing that, for women to continue to exercise at the same level they were before is safe and really can optimize their outcomes. Pregnancy is not really the time to start a new exercise regime. I sort of tell people it's not the time to run a marathon or take up kickboxing, right? But use your common sense, but you should continue to do what you did. And low impact things like even just walking can be super helpful. We recommend people walk at least 30 minutes a day, and you can even think of that in sort of manageable bites, right? So if you do it 10 minutes after every meal, we actually know that it lowers your blood sugars pretty significantly, so it can be very helpful in a pregnancy.
I have a question for you. I get a lot of my infertility patients who are really fit, and they do things like CrossFit and spin, and they get the message a little bit like, maybe my heart rate should be under 140. And it's kind of interesting. It's hard for me to advise them. I don't know how much you think that would be of value in an early pregnancy.
Yeah, I get that question a lot too. There's not great data about the heart rate stuff. I generally tell people not to wear a heart rate monitor. Or to, you want to do what feels comfortable. And certainly I think sometimes you do start feeling lightheaded or more uncomfortable sooner than you did before you were pregnant. And that's, your body sort of telling you it's time to stop. And, and you certainly don't want to get to that point. But I don't use any strict heart rate cutoff. And
just kind of follow what your body's trying to tell you.
I think for all the professional athletes who have healthy pregnancies now, certainly, I think we're a little bit more lenient or relaxed about our recommendations for exercise in pregnancy.
All right, here's another question we're getting. Maggie asked, do you work with bariatric surgeons or other weight loss specialists to co-manage patients with weight-related infertility? And the answer is we absolutely do. So we have a wonderful kind of group of doctors, both bariatric surgeons and doctors that specialize in helping patients with weight loss. And we frequently send our patients for a consult if they would like to. And I know it's a very personal decision about whether you want to consider bariatric surgery, but this group does a wonderful job in educating patients. So if they're not sure, I think more information is always so great for us to make decisions. And so just meeting with these doctors would be helpful.
No, I love that group actually. And the consult they have initially is usually with an endocrinologist, right? So I think there's a little bit less of an immediate push towards bariatric surgery, which patients really like, and just talk about all the options or nothing at all at the time. And, I also tell people to keep in mind that you can talk to them now, whether maybe that's not what you want to do right now, but maybe you want to think about it postpartum, right? For women having like a first baby, right? Maybe there's a period of time in their inner pregnancy actually where they could have bariatric surgery or do a more intensive medical weight loss program. So, you know, getting in touch with those resources even prior to the first pregnancy makes a lot of sense.
And I would say that office really has tremendous resources beyond what our offices offer as far as online support, different types of eating regimens and exercise that really, it's a great resource for patients to have a consult there. So
absolutely. All right, so Jenny asks, am I at higher risk of having my baby early? Should I expect a NICU stay? That's a great question that patients actually do ask a lot. So increased BMI alone is actually not a risk factor for spontaneous preterm birth.
Oh, really?
So it doesn't increase your chance of having a baby early just because you go into labor early.
Yeah.
In fact, actually you have a little bit less likelihood of going into labor at the end of pregnancy, right? So more likely to go post-term.
Yeah.
You are at a higher risk in general of having the baby early, though, because of an indicated preterm birth, right? So you have a medical complication of the pregnancy, whether that's hypertension or poorly controlled diabetes or a growth restriction or problem in the pregnancy that would lead to an earlier birth. So yes, a slightly higher risk. It's not as much higher, though, as you would think, especially for women who don't end up having another comorbidity. And should you expect a NICU stay? If you do end up having baby, so here, for instance, if you're less than 35 weeks, yes, you should expect a NICU stay. But beyond that, it's going to really depend on how the baby's doing.
Yeah.
So,
do you have a pediatrician automatically attend a birth of a high BMI patient with that risk? Like if your BMI is over 50, but everything else is fine, do the pediatricians are there immediately or not necessarily?
No, not necessarily. Yeah. So the babies that if they're term and otherwise healthy, then we don't expect more NICU complications. So
okay.
Yeah.
Oh, great. All right. I think that's all of our questions for now. So Sarah and I so appreciate everybody tuning in. If you have further questions, you can submit them and we will get back to you. And you can also learn more at yourbaby.brighamhealth.org, which has a lot of resources, and Dr. Little, who has so many resources to teach us about BMI and pregnancy. Yes. So,
absolutely.
All right. So thank you for tuning in.